Welcome back, everybody. I'm joined by Terry Streetman. He's the Public Policy Manager for Alzheimer's Association of Nebraska. I said that right? Right?
Got
okay,
it.
good.
Nailed
There's a lot of words there sometimes. Thank you. And we're here today to discuss, you're here today to discuss the Healthy Brain Initiative Roadmap. Very important stuff here. And explain, please, to our viewers what this is focusing on.
Absolutely. So the Healthy Brain Initiative Roadmap is a collaborative effort between us and the Centers for Disease Control. And it's a public health approach to Alzheimer's disease. This is a public health issue. Almost 6 million people are currently living with the disease in the United States, and that's projected to rise to 14 million by 2050. So we need to take a different approach and address this as a public health concern.
And state that just jumped out at me. The numbers again, by what year, 2050?
By 2050,
what
14 million Americans.
So doubling this and more.
Yep.
So obviously we're not any closer then to getting a cure, I guess, if you, I mean, it's simplified, but are when you throw those numbers out there, that's several years from now. So is that anticipated that they're not going to find a cure right now, or what's going on with it?
Our goal is always to find a cure. We want to put ourselves out of work and find a cure for this disease. But in the meantime, we know that we need to take more of a life course approach to the disease. There are people living with it now who need support and resources and education. So this roadmap and the public health approach, the goals are to educate the public and healthcare providers so that they have information about reducing risk and things like that so we can lower that impact. Building better partnerships so we can serve people who are currently living with the disease, especially in areas that maybe don't have as many resources.
Rural areas,
yep,
right?
Rural areas, higher risk populations. Also to develop the workforce. There's a huge workforce gap in some of these areas that don't have public health or health professionals to cover this need. And then to get better data so that we can say, you know, what that trajectory looks like and how and where we can address it.
So this is basically a four-pronged attack at attacking, going after Alzheimer's, because in the meantime, while you're working on getting a cure, which could be decades from now, let's face it, right, or years from now.
I mean, the goal is to do it much sooner than that,
I know,
but it's a tough job.
But in the meantime, you got to hit it somehow, and the cost associated with Alzheimer's has got to be staggering. Correct?
It's the most expensive disease in America. It threatens to bankrupt our whole healthcare system, and so that's why we want to look at every facet of this that we can: a cure or reducing risk now and decreasing that trajectory of the disease.
Okay. Real quickly, for someone at home wanting to learn more about what we're talking about, I just dabbed in it for a few minutes here, want to learn more, maybe they have a concern about a relative, a friend, maybe themselves, what should they do? So
you can always reach out to us. We have a 24/7 helpline. It's 1-800-272-3900. 24/7, just like it says. Any question that you have, we can help answer. You can also go to our website, alz.org/publichealth. You can find information about the roadmap. We also have a piece of legislation called the BOLD Infrastructure for Alzheimer's Act. We have support from Senator Fisher and Representative Bacon that addresses this on the national level. So if you're interested in working with us on these public health things or just have questions, please reach out.
All right, keep up the good work, and hopefully someday we will get a cure and knock this thing out for good.
That's the goal.
And put you out of work.
Oh, I'd love that.
You'll find another job fast enough.
That's right.
We'll be right back. Stick around.